superficial layer, and then as we go deeper, what are these going to be here? Rhomboids, and then Vader scap. Okay. And those are getting across, those are muscles that stabilize the scapula. And then we'll get into ones that actually cross the shoulder joint. You have muscles that are part of the rotator cuff. Anybody know what the rotator cuff is? It's usually used in mnemonic where you say six. Supraspinatus, infraspinatus, teres minor, and subscapularis. And we'll go over those again. So first we talked about muscles that don't cross the shoulder joint, ones that go to just the scapula and the clavicle, mostly to the scapula. So now we're talking about muscles that cross the shoulder joint. Okay. And then there's going to be 9 muscles. They're going to insert onto the humerus. So there's the pec major, the latissimus dorsi, and the deltoid. And those are going to be more superficial. And then deeper you get into the rotator cuff. So again, that's the SITS, supraspinatus, infraspinatus, teres minor, and subscapularis. Those are the rotator cuff muscles. And then you're going to have teres major. So to abbreviate it, if we put a small m, it means minor, and then a larger M, capital M, is going to be major. Sometimes to be more clear, sometimes you'll see it with a capital M with a J, and then a lowercase m for minor. And then coracobrachialis. So what is the 2 attachment points to the coracobrachialis going to be? Coracoid process and what? The brachium. So it's going to be kind of a short little muscle right here. And then the prime movers of flexion, pec major is going to be the prime mover of flexion. Although once you start going past here, you're starting to work other muscles. And then the latissimus dorsi and the back part of the deltoid are going to be the prime extensor muscles. And then what's going to move the arm up like this? Yeah, deltoid. So that's going to be right here. And then you have the rotator cuff muscles. Okay. So this is still under construction, so if you can't quite understand it, just bear with me here. So this is going to be what? This is the humerus, the head of the humerus, right? And so the rotator cuff, what those muscles do is they pull it in tight to hold it in, right? Okay. So you can have the supraspinatus, which is above. So this is the spine of the scapula right here. So here's the supraspinatus muscle, and that's going to do this motion like this, right? But all these rotator cuff muscles, they're cupped that hold them in like this. Okay? So then what's this one going to be on the front here? Yeah, subscapularis. And then if this one's above the spine of the scapula, what are these 2 that are below? So what's this one here? Below the spine of the scapula. Infraspinatus, and then teres minor. Okay. Whereas you have this other one here, this one that's on the back, but it doesn't go to the back part of the humerus, it goes to the front. That's the teres major. Okay. That's the one that, we'll see pictures of it later, but it comes out down below the scapula here, and it comes across like this, because it's an external rotator. Whereas the teres minor, what action would that do? It's on the back part. It do what kind of rotation? External rotation, right? Because if it's under here, okay, so if it's right here, it's pulling this way, it's going to do external rotation. And then the subscapularis, what kind of rotation is that going to do? Internal rotation. Okay. We'll go over those again. It's just a thing you have to repeatedly go over to understand. Okay, so basically The main thing that they're going to do is to hold that humerus in. Okay? It's like a cuff, and it pulls it in like that. Okay? So on the top you have this supraspinatus, and then on the front you have the subscapularis, and then the two on the backs, the infraspinatus and the teres minor. And they're pulling that humerus in to keep it onto the glenoid fossa. Okay? But then there's secondary actions are going to be either internal rotation or external rotation or abduction. And then you have coracobrachialis and the teres major. Those are going to also be synergists to help stabilize the shoulder joint. Because the coracobrachialis is holding in here to help hold that in. And then the teres major is going to help reinforce the shoulder as well. The main ones that do it are this rotator cuff. So if we just look at the muscles in a general sense, okay, if you're looking at the front muscles of the shoulder, what kind of general motions are they going to do? Are they going to do flexion or extension? Flexion. Right. And then are they going to, what kind of rotation are they going to do? Well, pulling this way, which way is it going to rotate? It's going to pull in this way. Okay. So then if we talk about posterior group, what are their motions going to be in a general sense? Extension, and then what kind of rotation? External rotation. There is a couple exceptions though, like I said, because the teres major starts out on the back, but it goes to the front, so it's an internal rotation. So these are just general concepts that apply to most of the muscles, but there's going to be exceptions. And then the middle, or the lateral side here, what action are those muscles going to do? Yeah. Abduction. So now, does the pec minor muscle, does that cross the glenohumeral joint or the shoulder joint? Because all it's going to do is go into here. So somebody have somebody down for pec minor. Is Elizabeth here? Yeah. Are you Elizabeth? Or do you guys want to do it? If you want to do another one later, that's fine. Okay. And so then, so pec minor basically, in this case, the origin is on the torso because the insertion is going to move towards the origin. So it's going to be on the pec area here. This is going to be the anterior surface of the third to the fifth rib. And that's on this area here, and then it's pulling the coracoid process down this way. So it's moving the scapula down like this. It's going to bring it forward as well as depressing it. So it's protraction and depression. So it's going to move it like that. And then next we have the serratus anterior. And then Jessica.
Please read aloud.
Yeah. You have.
A little paragraph.
Yeah, that's fine.
I'll just sit
What's that?
here, right?
If you really want to, but usually we'll have people come up. But if you want to stay there, sit down.
Yeah.
Yeah, that's right.
Okay. The serratus anterior is a muscle that originates on the surface of the upper 8 ribs at the side of the chest and inserts along the entire anterior length of the medial border of the scapula. It's occasionally called the boxer's muscle because it is largely responsible for the contraction of the scapula. That is the pulling of the scapula forward and around the rib cage that occurs when someone throws a punch. The serratus anterior also helps to stabilize the scapula. In addition, it assists in rotating the scapula upward.
Yeah, because if it's kind of, it attaches to the medial border, but the fibers go down this way, so it's going to pull it down like that. Okay? But what also it does is that it keeps the scapula from winging. Because if you have a weakness of the serratus anterior, what happens is the scapula is going to wing out in the back.